facilitating the changes, you've got to be open to change. Change comes across when there's chaos. And there's a lot of chaos in the market right now. And what they need to be doing is learning what they need and starting with electronic health record, moving to having HIEs, business intelligence. They have got an ICD-10. They have got to jump in and play in the game. What is keeping, if you look at healthcare in general, healthcare, there is not a lot of risk takers. There's not a lot of early stage adopters. It's sort of been the philosophy when we've been in healthcare. But what is keeping them from jumping into some of the big areas such as ACO? They have so many initiatives that they're already involved in. They're trying to meet meaningful use. They're trying to get the EHR up and running. ICD-10 is going to be taking an enormous amount with ICD-11 coming around the corner. So they have so many initiatives, also not having the cash to be readily accessible to go and move forward. On coordinated care, they're all trying to move there somehow. And some of the examples that we show is that they're putting the tools in place. They're realizing what the role that the primary care physician has. They are aligning with physicians. They are buying physician practices. They are buying the tools that are necessary. And they are doing pilots that are based on what our community needs versus pilots that are based on ACOs and have savings and government reimbursements. They really have to look at what their population mix is. And a lot of them are starting with their employees. And this has been one of the biggest areas that you're seeing in the industry right now. You have plans that are starting an ACO that are involved with their employees. This is a population that they know that they can have the patient involved. The success of an ACO and collaboration is going to be having the patient involved. And when it's an employee, it is the easiest place to start. Also, if you look at some of the payers that are involved, that is going to also assist. But I think starting with your employees who are part of your organization is the best place to start with an ACO. And that's what I'm seeing more collaborative care and ACO pilots going toward. Undoubtedly was an EHR, but the interesting thing is an EHR is not a requirement anymore of an ACO, but it was the number one because how can you have collaborative care without an EHR? So even though it's not required, you're not going to see people jumping into ACOs without having the EHR. They do get a few extra quality points for having one though. I think the advice is that you've got to end up taking this slow and waiting for the return. It takes a lot to get it set up. Don't expect to get the returns quickly. Expect to get better quality gradually and then gradually get the cost savings. Don't expect it overnight and give it up. It's going to be a long process, but in the long run, everyone's going to win from it.